Hi, my name's Manan Sampat. I am a comprehensive ophthalmologist, and I joined with the Ephraim McDowell Eye and Vision Center in September of 2020. I grew up in New Jersey, and while I have family all over the United States, my wife and I have moved a good number of times throughout my medical training. I went to medical school in New Jersey, trained for my intern year in Toledo, Ohio, and then finished my ophthalmology training in New York City. We have family here in the area, and so when we came down here, we fell in love with the community. We really liked all the people that we met, both at here, Ephraim McDowell, and also in the community in which we live. And so it's just been a wonderful opportunity for us to be here and, start raising our family. From a young age, I always had a liking towards the sciences and mathematics, and as I grew up, I realized that medicine was the perfect blend of applying science and math, but also to real problems. In medicine, these problems are real. They affect patients on a daily basis, and I really like the idea of using this knowledge of science and math to then do something positive for people that really goes a long way on their daily basis. I really find economics fascinating, so I probably would have gone down the route of macroeconomics. I love spending time with my kids. I have a daughter and a son, both of whom are very energetic and love doing all sorts of board games and puzzles, and they are really a handful, but in my free time you'll find me playing with them. And then otherwise I enjoy reading and spending time with my wife and cooking together on occasion as well. Ophthalmology is the perfect blend of all sorts of sciences, including obviously general medicine, but of course the niche field that it is, it's very specialized to the eye, and I like to think that by just treating the eye, you actually have a profound impact on someone's health. Secondly, there are so many different procedures, many of which are highly specialized, challenging, and it brings a great joy to be able to practice these and offer them to patients so that we can help improve vision and restore vision as much as possible. They can expect a comprehensive exam and therapy that's tailored to them. Of course, before any procedure or any therapy that might be indicated, you can expect that we would go through it thoroughly and make sure that every patient understands exactly what all of their eye problems are. I think it's very important that patients understand that the eye is a very complex organ. It's a very fragile and delicate system, and so while there are many parts to it, we try to make sure that patients understand all of the problems that may be in their eyes, and I do think that the more you understand, the more empowered you are as a patient. Being able to restore sight and prevent it from getting worse. I think that is the most rewarding thing as an ophthalmologist, to be able to figure out what problems there may be in someone's eyes and to help figure out exactly how to restore the vision. And it's a wonderful thing to be able to see people who don't see well at all, and after cataract surgery or some other procedures that we do in the office, we can restore a lot of vision, and it's very gratifying to see how they are fully functional after these procedures, because now they're starting to realize they were missing out on so many vivid details or colors in their surroundings, or now they can see and they can draw. They can appreciate people's faces. So these are always wonderful accounts that I get to hear from time to time from patients, and it always reinforces why I went to ophthalmology in the first place.